Hey everyone, welcome back for another deep dive.
Always exciting to be back.
Today we're going to be talking about something I know you guys deal with all the time as general practitioners, contraceptive counseling.
Yes.
We have a lot of really interesting research, and the interesting thing is it's not just about new methods of contraception.
Right.
It's really about how we should be talking to our patients about this.
Yeah, there's definitely a big shift happening in how we think about contraceptive counseling and it's less about just preventing pregnancy and more about helping patients meet their own reproductive goals.
So what does that actually look like in practice?
So one of the things that the research really emphasizes is that we need to move away from this assumption that everybody who comes in to talk about contraception is just looking to avoid pregnancy.
Okay.
The reality is people's feelings about pregnancy are complex,
Right.
and an unintended pregnancy isn't always an unwelcome pregnancy.
So how do we start to uncover those individual preferences and goals?
Well, it starts with how we frame the conversation.
Okay.
So instead of just jumping straight into, do you want to become pregnant in the next year?
Right.
We can use more open-ended questions like, what are your thoughts and feelings about pregnancy? Or
Mhm.
what are your hopes for your reproductive future?
I like that a lot better.
Mm,
I feel like that really invites patients to share their own perspective rather than
mm,
just giving like a yes or no answer.
exactly.
Yeah.
It's important to remember that those perspectives are going to vary widely, depending on their circumstances,
Of
their
course.
background, their values.
Absolutely. One of the sources that we looked at actually provided a table with a bunch of different ways to initiate that conversation about reproductive goals. And I thought that was really interesting to see all of the different nuances that, maybe we don't always think about.
Right. It's a great resource to have
Yeah.
to help us sort of move beyond those default questions
Yeah.
and really personalize the counseling experience.
Right. Yeah. I think that was one of the things that I was really noticing too was this shared decision making.
Yeah.
And how it's not just about, here's the list of pros and cons for each one. It's a much deeper process.
It definitely is. It's about recognizing that ultimately the patient is the one making the decision.
Right.
Our role is to provide them with the information
Right.
and support them in weighing their options based on what their needs are and their preferences.
Absolutely. There was a really helpful visual in one of the articles that kind of broke down that shared decision-making process.
Okay.
And it started with like building rapport and trust with the patient
Yeah.
and then understanding their preferences and their values and then exploring the different options. I thought that was a really good visual representation of that process.
It is. It's a good way to think about it. And one of the things that really resonated with me was this idea of eliciting informed preferences.
Right.
It's not enough to just ask the patient, what do you want? We need to make sure that they have the knowledge they need to actually make an informed choice.
So how do we do that?
So it's about having those in-depth conversations about all of the characteristics of each method.
Okay.
We need to talk about efficacy, of course,
Mm-hmm.
but we need to talk about things like frequency of use,
Right.
side effects,
Mm.
impact on menstrual bleeding,
Right.
and even, non-contraceptive benefits.
Yeah. And I think speaking of menstrual bleeding, I think that's a topic where people's preferences can be really diverse.
Absolutely.
Some people might see amenorrhea as like a huge plus.
Right.
Other people might find it really concerning.
And there's a lot of misinformation out there
Oh, yeah.
about what's normal and safe when it comes
Yeah.
to menstrual changes.
Mm.
So it's important for us to be able to address those misconceptions.
One of the articles mentioned that sometimes people will come in and they already have kind of negative perceptions about certain methods
Right.
because of things that they've heard,
Sure.
whether it's from friends, family, or even things that they've read online.
Right. And that's where our communication skills really come into play.
Yeah.
It's important to validate their concerns and acknowledge that, those anxieties are real,
Yeah.
even if they stem from inaccurate information.
Right. One of the sources had a good table about that, about how to respond to something like that, where, it's like, I understand why you might be worried about that, but the research actually shows,
Mm-hmm.
this or that.
Exactly. It's about finding that balance
Yeah.
between acknowledging how they feel
Right.
and providing them with accurate information.
I was really surprised to read in the research that positive sexual experience while using contraception was actually a predictor of patient satisfaction.
Mm-hmm.
Why do you think that is?
That's a great question. It likely has to do with just feeling in control of your body and your choices.
Yeah.
And when contraception allows someone to fully enjoy their sex life without worrying about pregnancy,
Hmm.
it can have a profound impact on their well-being.
Right. How can we incorporate that into our counseling sessions?
I think it's as simple as asking about their sexual experiences and how they think different methods might affect them.
Okay.
It might feel a little uncomfortable at first,
Yeah.
but I think creating that space for open conversation
Sure.
can make a big difference.
Yeah, I think it's about normalizing that conversation
Exactly.
and making it clear that we're there for all aspects of their reproductive health, not just the medical side of things.
And remember, we also need to be mindful of our own biases
Oh, for sure.
and preferences when it comes to methods.
Yes.
We might have our own opinions about certain options, but ultimately,
Absolutely.
it's about helping the patient choose what's best for them.
Absolutely. Yeah, speaking of biases, there's some interesting information in here about counseling patients of color
Yeah.
and how there are still some pretty concerning trends about,
hmm
how care is being delivered.
It's true. We need to be constantly reflecting on our own implicit
Mhm.
biases and how that might be affecting how we're interacting with patients.
Right. One of the sources mentioned that the shared decision-making model can help mitigate that
It can.
by really listening to the patient, understanding their preferences, and presenting options in a non-judgmental way. I think that that really does help to create a more equitable experience.
Right.
So I think to kind of sum up this first part of our deep dive, it seems like the key takeaway is that effective contraceptive counseling is about more than just preventing pregnancy.
Absolutely.
It's about understanding our patients' goals, providing them with information, and supporting them in finding the method that fits their lifestyle and preferences.
I think that's a great way to sum it up.
Awesome. Before we move on to talk about same-day starts and emergency contraception, I wanted to just pause for a moment and ask you, what's resonating with you the most so far from this discussion?
It's a good time to reflect on how these principles can shape our approach to contraceptive counseling
Yeah,
and what we do in our practice.
Great. All right, so we're going to take a quick break, and we'll be right back to talk about same-day starts and emergency contraception. So let's get back into it and talk about same-day starts.
Yeah.
Because I know this has evolved a lot in recent years. There used to be a lot of hesitation
Yeah.
about starting people on contraception right away, especially if they had recently had unprotected sex.
Right. There was a lot of emphasis on, waiting till the first day of their next cycle
Yeah.
or making sure they weren't pregnant already.
Right. But it sounds like the research really challenges that thinking.
It does. The research actually shows that for most patients, same-day starts are both safe and effective,
Okay.
even if they've had unprotected sex recently.
So that's great news for patients because they can start protecting themselves right away
Exactly.
without any unnecessary delays.
Absolutely. And that can make a big difference in
Yeah.
terms of preventing unintended pregnancies.
Of course, there's some situations where we might want to be a little more cautious, right?
Yeah. Right? Like if somebody's in the luteal phase of their cycle
Okay.
and there's a possibility of an existing pregnancy.
So how do we determine if a same-day start is appropriate?
One of the sources actually provided a really helpful checklist
Okay.
that kind of walks you through the steps.
Okay.
And it takes into account things like when they last had intercourse,
Okay.
whether they've used hormonal contraception recently,
Mm-hmm.
if they've had any bleeding since their last period.
And so it's kind of like a decision tree,
Exactly.
helping you go through all the different scenarios
Yeah.
and assess that risk of a pre-existing pregnancy.
Right. And the good news is that the research shows this kind of checklist is very reliable.
Okay.
Studies have found that it has a negative predictive value of 99 to 100% for ruling out pregnancy.
So we can feel pretty confident
Yes.
using those tools.
Yes.
And, of course, we can't talk about immediate action without talking about emergency contraception.
Right.
That's a crucial part of this whole conversation.
It is.
For all patients, no matter what their ongoing method is.
It's sort of like that safety net that we all need just in case.
Exactly. So what are some key things to keep in mind when we're talking to patients about emergency contraception?
I think the most important thing is just making sure they know that it's available
Okay.
and that they know how to access it.
Mm-hmm.
There are a few different options out there. There's the copper IUD.
Right.
There are hormonal pills.
Mm-hmm.
There's a medication called ulipristal acetate.
Right.
Each option has its own pros and cons.
Sure.
So it's important to talk to patients about, the different characteristics of each one.
It's interesting that you mentioned IUDs because one of the sources highlighted the dual role that IUDs can play
Right.
in both emergency contraception and ongoing contraception.
It's true. If a patient is considering an IUD for ongoing contraception and they need emergency contraception, An IUD can be a really great option.
Right, so they get that immediate protection,
Exactly, they get both.
and then they're all set for the long term.
And they're set for the long term.
It's interesting to think about emergency contraception because I feel like there are a lot of misconceptions out there.
Yeah.
What are some of those that you encounter?
One of the most common ones that I hear is that emergency contraception is like an abortion.
Oh, yeah.
And it's important to clarify that that's not true.
Right.
Emergency contraception works by preventing or delaying ovulation
Mm,
or by interfering with fertilization.
right. It's not interrupting an existing pregnancy.
It's not interrupting an established pregnancy. That's really important.
And it really highlights how important it is to have clear and accurate communication.
Right. We want to be providing them with the facts so that they can make
Mhm.
informed decisions.
Yeah, so let's shift gears a little bit and talk about tailoring our approach
Yeah.
to diverse patient populations.
Sure.
Because the research really emphasized that, one size doesn't fit all.
Of course not. Adolescents have different needs than
Yeah.
adults. Postpartum individuals have different needs. People with certain medical conditions
Right.
might need more specialized guidance.
And we can't forget about cultural sensitivity
Absolutely.
and addressing our own potential unconscious biases.
Yes. Especially when we're counseling patients of color.
Right, because the research did highlight some really troubling disparities.
Yeah, it's something that we need to be actively working to dismantle
Mm-hmm.
and making sure that all patients are receiving respectful, patient-centered care.
And one of the things that was suggested was that shared decision-making model can be really helpful
It can.
in mitigating those biases.
It can.
By actively listening to patients, understanding their preferences,
Yeah,
presenting options in a non-judgmental way.
absolutely.
I think that goes a long way in creating a more equitable
That's
experience.
for sure.
So I think this whole conversation is really highlighting how important individualized care is.
Right.
We can't make assumptions about what our patients want or need. We
Yeah.
have to ask, we have to listen and be willing to adapt our approach
Exactly.
based on their individual circumstances.
So as we move into the last part of our discussion, I want you to think about, the specific needs of your patient population.
Okay.
How can you adapt what we're talking about
Okay.
to make sure that you're meeting their needs effectively?
I think that's a great question for everyone to be thinking about.
It is.
As we move into this last part of the deep dive, where we're going to be tackling some common myths and misconceptions.
I think you'll find this part very interesting.
Okay, I'm excited to hear this. Okay, so let's get to those myths you were talking about.
Yes, I think there are a lot of assumptions floating around out there about contraception,
Mm-hmm.
and they can really affect how we counsel our patients.
For sure. So which ones should we talk about first?
Well, one of the biggest ones I hear a lot is this idea that all unintended pregnancies are unwelcome.
Okay,
And that's just not true.
right. People's feelings about pregnancy are complicated.
They are very common.
There's so much that goes into that. It's not a simple yes or no.
Exactly. Some people might be open to an unplanned pregnancy.
Right.
Others might be ambivalent about it.
Mm-hmm.
The important thing is there's no right way to feel.
Yeah.
And our job is to just support our patients in whatever choice.
Right. To help them figure out what's right for them.
Exactly. In making the choice that aligns with their values.
Okay, and another one I've heard is that unintended pregnancies always lead to bad health outcomes for both the mother and the baby.
Right. And the research shows that's not always the case.
Okay.
There are definitely some risks associated with unintended pregnancy,
Right,
but
yeah.
it doesn't necessarily mean that there are going to be poor outcomes.
Oh.
Access to good prenatal care and socioeconomic factors also play a big role.
So it's really about looking at the whole picture
It is.
for each individual.
Yeah. And this kind of leads into another myth I hear, which is that contraceptive efficacy is the only thing that matters to patients.
Yeah, I think we get so caught up in those perfect use failure rates.
We do. We want to give our patients the most effective methods.
Right, of course.
But we also have to consider the other things that matter to them.
Like what?
Well, things like convenience.
Mm-hmm.
People want something that's easy to use,
Yeah.
that fits into their lives.
Right.
Side effects are also a big consideration,
That's it.
and personal preferences
Like,
about hormones, bleeding patterns, even how it affects their sex life.
yeah, so many factors to think about.
There are.
I think this really highlights how we can't just focus on what we think is best.
Right.
We have to really figure out what matters most to the patient.
Absolutely. Choosing a contraceptive method is a personal decision.
Mm.
There's no one right answer.
And I think this whole deep dive is really emphasizing that individualized care.
I agree.
Really listening to our patients,
Yeah.
understanding what they want, and being flexible.
Being willing to adapt
Yeah.
based on their needs.
And that shared decision-making model is such a valuable tool for that.
It empowers patients to be a part of the process
Mm.
and helps build that collaborative relationship.
So what are your main takeaways from this whole conversation?
Well, I hope people listening will feel inspired to really embrace this patient-centered approach.
Mm-hmm.
Let's move past those assumptions,
Yeah.
challenge those old myths,
Yeah.
and really listen to what our patients are telling us.
It's about meeting people where they're at
It is.
and providing care that works for their lives.
And remember, there are a lot of resources out there to help.
Yeah.
Websites like Bedsider and Planned Parenthood,
Mm-hmm.
they offer great information for both patients and providers.
And in Canada, there's sexandyou.ca.
Yes,
They even have a tool to help people explore the different options.
it's a great resource.
So don't be afraid to reach out for help if you need it.
You don't have to do this alone.
Okay, so as we wrap things up, I have one last question for everyone listening.
Right.
How can you use what we've talked about today to make your contraceptive counseling more patient-centered,
Yes.
more inclusive, and more empowering?
It's a challenge, but it's a really important one.
It is. It can make such a difference in your patients' lives.
So let's have those open conversations and support people in making informed choices about their reproductive health.
That's a great way to end this deep dive, I
And I
think.
agree.
So thank you so much for joining us, everyone, and we'll see you next time.